Hello everyone, we are from Group 3 at NNPD 6014 would like to present our case study 2 with the title Mixed Model ANOVA. Our study title is the effects of aerobic exercise on the high-density lipoprotein cholesterol among coronary artery disease (CAD) patients with different body mass index in Hospital X. Introduction: High prevalence of excess body weight in developed and developing countries, including Malaysia, and cardiovascular disease is the major cause of death in women. Aerobic exercise helps to reduce the BMI and increase HDL-C level. Research objectives: First, to determine the prevalence of gender among CAD patients. Second, to determine the interaction of BMI and aerobic exercise intervention in affecting HDL-C level among CAD patients. Research question: Is there any interaction of BMI and aerobic exercise intervention in affecting HDL-C level among CAD patients? Research hypothesis: There is an interaction of BMI and aerobic exercise intervention in affecting HDL-C level among CAD patients. Methodology: Our study is an experimental study and we use stratified random sampling. We have 52 sample size, which is 26 normal BMI and 26 obese patients. We conducted this study in Hospital X. As for the procedure, every patient's height, weight, and body mass index will be measured by using anthropometry measurement. Then, every patient's serum HDL-C level will be measured before the intervention. Next, every patient will have cycle ergometer training, 5 sessions per week, 30 minutes per session for 12 weeks. Ergometer load will be increased by 10% every 2 weeks. And after the intervention, every patient's serum HDL-C level will be measured again. For data analysis, we will use descriptive analysis for Objective 1 and mixed model ANOVA for Objective 2. And these are the 4 assumptions that should be met. The Shapiro-Wilk test confirmed that HDL levels data was normally distributed. The SPSS output showed that the assumptions of homogeneity of variance have not been violated. As for the results, majority of the patients were married and Malay. Result Objective 1. Majority of the patients that participate in the study is female, which is 55.8%. Result Objective 2. This SPSS output showed there was a significant interaction in HDL-C levels between before and after aerobic exercise intervention and BMI. This SPSS output showed the main effect of BMI was not found. This figure showed obese CAD patients showed greater improvements in HDL-C levels compared to normal CAD patients after the intervention. As for discussion, these a few researchers showed that there is interaction between moderate intensity of exercise, such as aerobic exercise, and can be beneficial in increasing HDL-C levels in CAD patients with different BMI. Individuals with high BMI associated with low HDL-C with the risk of cardiac issues and mortality is observed, and aerobic exercise is effective to increase HDL-C. Normal CAD patients showed lower improvement in HDL-C level compared to obese patients. In future research, we may study the mechanisms and other factors that affect HDL levels. In conclusion, the aerobic exercise intervention is effective for both normal BMI and obese CAD patients. There is a significant interaction in HDL-C levels between before and after the aerobic exercise intervention and BMI among CAD patients. These are the list of references.
Created using Powtoon.